عليكم ورحمة الله وبركاته. I am Al-Duais Hassan Jamal Abdullah, matric number 252119, preparing this presentation of cervical cancer risk classification for Dr. Noor Hazleen Binti Haroon. Now, introduction about our project is to find and collect the data about the cervical cancer risk and use it in MLB, multi-layer syndrome, using Python code to classify the problem in the dataset and see the risk about the cancer. Now let's talk about the cervix cancer risk. First, what and where it founds. The cervix is located in the lower part of the female uterine inside the female reproductive system. The part is usually 2 cm and can get up to 3 cm, and it's in shape of a cylindrical. What are the causes for the cervical cancer? The causes there is many causes like the diabetes and the sexual partner and smoking habits, and can get skin diseases can also be a part of the cervical cancer. How risk can it get? The death in this cancer is rare among the young women, but it can be higher when the age up to 30. And the most women who has cervical cancer is between 40 and 60 years old. Now let's move to background. We will talk here about dataset and code. Explain first dataset. We found the dataset in Kajal website, and it has 891 volunteers answering the question about the sexual diseases and the skin diseases, and also the smoking habits among the age and the pregnancy. This dataset we divided into two parts: test and training data, 80% and 20%. And also there was an empty spaces in the dataset. We preparation the data before use it in the code. The code we find in the Kaggle, it's first of all we make the data numberable, so the computer can understand it. And also we use course tools, which is a multi-layer percentile tool that helps classification the data more easy and more fast. Now I leave you with my friend Shafiq to explain more about the dataset and the code. Thank you very much for listening to me.
Assalamualaikum warahmatullahi wabarakatuh, and good day to Dr. Noor Hazlina binti Harun. My name is Muhammad Shafiq Hakimi bin Muhammad Azlan, and my metric number is 262293. So for today, I will continue the related work for cervical cancer risk classification. In this related work, we have choose 5 best articles and journals to use in this related work. The first paper is more focused on special operation to reduce the noise in the cervical image. This paper had chosen backpropagation neural network to classify the cervical cancer. The next article have the same purpose and algorithm that have been used in the studies to diagnose the risk of cervical cancer, classification based on feed-forward multi-layer perceptron. The third article is the researcher more focused on the comparison of pap smear classification by using several machine learning algorithms such as k-nearest neighbor, neural network, and naive Bayes classifier. The next paper is to compare the effectiveness of multi-layer perceptron using backpropagation algorithm to diagnose the cervical cancer among women. Last but not least, this paper has related to this research is more focused on the benefit of using artificial neural network and multi-layer perceptron architecture. Next is methodology. In methodology, these papers undergoes four main important phases, which are data collection, experimental setup, training and testing, last but not least, result and analysis. The first part in methodology is data collection. In this first phase, the cervical cancer risk classification dataset has been searched from the Machine Learning Repository website, Kaggle. From this website, the dataset has been obtained, and this dataset contains 34 features with 858 instances. These instances were divided into two parts. The first part is training and the second part is testing. For training, we use 80%, which contains 686 instances, and for testing, we use 20%, which contains 172 instances. The next part for methodology is experimental setup. In this experimental setup, we have two main important things. The first thing is multilayer perceptron, and the second one is the back propagation. Multilayer perceptron is well known as a feed-forward neural network that consists of one or more hidden layers. For back propagation is well known as a model that consists of a multi-layer perceptron neural network. Backpropagation algorithm has been widely used to train the recurrent neural network. The last part in the methodology is training and testing a result and analysis. After completing all the phases in 1 and 2, training and testing are performed. The result of the architecture and algorithm being analyzed and evaluated. Next, we move to the finding of cervical cancer risk classification. For finding, these are the confusion metric for classification of cervical cancer. Table 1 shows the evaluation result that obtained by performing multilayer perceptron in cervical cancer risk classification. The performance of multilayer perceptron is measured by looking sensitivity and specificity value. Sensitivity value is represent the proportion of true positive among instances classified as positive, while the specificity value represent the proportion of true positive among all positive instances in the data. The performance of back propagation evaluated based on false positive rate and false negative rate value where were obtained 0.030% and 0.500% respectively. Next is conclusion. For the conclusion, performing classification for the cervical cancer dataset is an important task that can facilitate medical officer and doctor to classify the cervical cancer into normal and abnormal cells. In order to perform the classification well, multilayer perceptron and backpropagation had been used in this study. Sensitivity, specificity, false negative rate value, and true negative rate value have been used to measure the performance of the MLP architecture and the backpropagation algorithm. That's all from us. Thank you and Assalamualaikum warahmatullahi wabarakatuh.